Welcome to SEF Nursing News at 9. My name is Zachary Willis.
I'm Michaela Bowman-Silva.
And I'm Keisha Hellman. We are here to talk about the effects that exercise has on the neurodegenerative disease of Alzheimer's.
Alzheimer's is a disease that specifically affects the neurosynapses of the cerebral cortex. The pathophysiologic presentation is due to the presence of aggregated amyloid beta 42 molecules that accumulate in the synaptic cleft, preventing conduction of chemical signals and an overabundance of tau tangles within the neurons themselves. At this time, there is no known cure for Alzheimer's disease.
Several studies have shown that cardiorespiratory exercise delays progression of Alzheimer's in patients who are in the early stages. The pathways of their neurosynapses as well as their memory and gait showed improvement. Though there is no new medical intervention that cures Alzheimer's disease presently, research has shown that exercise has proven to be pivotal in slowing down the symptomatic and pathophysiologic presentation of Alzheimer's. A research project performed by the University of Maryland was conducted to test the effects of exercise cessation over a 10-day period.
Their hypotheses were that 10 days of physical inactivity would alter cerebral blood flow in the areas known to be susceptible to age-related decline, and that detraining would decrease hippocampal blood flow. Alzheimer's disease specifically targets the hippocampal region of the brain, which is important for learning and memory.
Their study, conducted on 15 master athletes, measured the resting cerebral blood flow pre- and post 10-day cessation through perfusion-weighted MRI, and found a significant decrease in vasculature over 8 areas of the brain, with the most dramatic effect in the bilateral hippocampal region.
The research concluded that there is a decrease in cerebral blood flow in the areas of the brain that are known to be susceptible to age-related decline, specifically in the hippocampus, but there would need to be further research to determine how cognition declines over longer periods of time. The study found no decline in cognition among the 15 participants after 10 days of exercise cessation. Another study was performed to show the effects that exercise has on the production of BDNF, or brain-derived neurotrophic factor.
BDNF is a protein that is produced by the neuron and is said to be a miracle molecule. BDNF travels across the synaptic cleft retrogradely with neurotransmitters such as acetylcholine and travels from the dendrites to the soma. The BDNF molecule has a series of transformations in gene expression patterns that promote neural health, survival, and protects them from toxins. It stimulates synaptic function and plasticity and is essential for synaptic memory. During exercise, BDNF increases specifically in the hippocampus, which is the targeted area for the pathology in Alzheimer's disease.
A survey of nurses showed that 1 hour of activity a day at 3 different activity levels show exponential increases in BDNF per hour, from strolling to aerobics to jogging and running, with strolling having negligible effect, aerobics having moderate effect, and jogging and running having the most beneficial effect on BDNF production.
A study was done to see what kind of effects stopping and starting exercise had on the buildup of BDNF, because it is almost impossible to maintain a consistent exercise routine in our everyday lives. The study showed that after 2 days of exercise, there was little improvement. It would take at least 2 weeks of consistent exercise, 1 hour a day, to get levels of BDNF that were significant for brain health. After the 2 weeks of consistent exercise, if there was a break for 1 week, it would only take 2 days of exercise after the break to regain levels of BDNF, showing that there is a molecular memory for BDNF. They also found that aerobic exercise reduces the level of phosphorylated tau tangles, which accumulate within the neurons in the presentation of Alzheimer's, and increases cerebral blood flow, which provides needed nutrients and carries away waste and toxins.
Here are some exercises that you can teach your patients. Over to you, Zach. Wall push-ups. Face a wall, standing a little farther than arm's length away, feet shoulder width apart. Lean your body forward and put your palms flat against the wall at shoulder height and shoulder width apart. Slowly breathe in as you bend your elbows and lower your upper body toward the wall in a slow, controlled motion. Keep your feet flat on the floor. Hold the position for 1 second. Breathe out and slowly push yourself back until your arms are straight. Repeat 10 to 15 times. Rest, then repeat 10 to 15 more times.
Overhead arm raise. You can do this exercise while standing or sitting in a sturdy armless chair. Keep your feet flat on the floor, shoulder width apart. Hold weights at your sides at shoulder height with palms facing forward. Breathe in slowly. Slowly breathe out as you raise both arms over your head, keeping your elbows slightly bent. Hold the position for 1 second. Breathe in as you slowly lower your arms. Repeat 10 to 15 times, rest, and then repeat 10 to 15 more times.
Balanced walk. Raise arms to sides at shoulder height. Choose a spot ahead of you and focus on it to keep you steady as you walk. Walk in a straight line with one foot in front of the other. As you walk, lift your back leg. Pause for 1 second before stepping forward. Repeat for 20 steps, alternating legs.
Oh man. Oh, those are just a couple of the many exercises you can teach your patient to do that don't require weights and can be accomplished with everyday household items.
Increased muscle strength leads to improved brain function in adults with mild cognitive impairment, or MCI. What we found in this study is that the improvement in cognitive function was related to their muscle strength gains.
Breaking news!
Physical activity is imperative. However, studies have shown that mental exercises promote neuroplasticity and cognitive reserve. Alzheimer's is essentially the result of losing synapses. Thus, by making new synaptic connections, you can prevent the disease. There was a specific study done with 678 nuns who were followed for more than 2 decades. Over these years, the nuns were encouraged to participate in regular physical and mental exercises. They were brought in on a regular basis to assess their physical and mental abilities. Upon their deaths, they donated their brains to science. 75 of these subjects had all of the physical abnormalities associated with Alzheimer's disease. However, they had absolutely no symptoms due to their backup synapses produced by their committed physical and mental exercises.
Mentally challenging activities like learning a new skill or adopting a new hobby or continuing formal education may have short and long-term benefits for cognitive growth and health. To keep your mind active, it is important to engage the mind in new situations and new topics. Challenge yourself to high-level reading or strategy games, but make sure they're things that you enjoy. It will be easier to continue mental exercises if you actually are having fun with the activity. Taking classes to learn a new instrument or a new language are other productive options for cognitive growth. Social activities can also lower risk for depression, which is a risk factor for Alzheimer's disease.
The current curriculum states that there is no new way to prevent Alzheimer's disease, but there are ways to limit your risk. No new studies have shown ways to eradicate Alzheimer's disease, but researchers have determined which molecules are the driving force behind neurohealth, BDNF being the main component. In the future, the effects of BDNF on neurohealth should be added to the curriculum.
And that was SEX Nursing News Nugget of the Day. I'm Michaela Bowman-Silva.
And I'm Zachary Willis.
And I'm Keisha Hellman. Raise arms to the side, shoulder height.
Okay, do it again.
What happened? Kayla. Okay.
Yeah. His mouth makes it even better. That was perfect. Good job, guys.
Good work.
My hands are so gross. Look at this. I was like this the whole time. Okay. I like the ending. Don't change it. Because I don't think I can do that again.
No mannequins were harmed in the making of this film.